Hello, welcome. Today we'll be discussing the clinical anatomy of the radial nerve. So, radial nerve is one of the important nerves of the upper limb alongside the medial nerve and the ulnar nerve. So, here you can see the gross course of the radial nerve. It originates from the neck, which is called the brachial plexus. You know the brachial plexus, it's a plexus, complex plexus formed by the nerve roots originating from the cervical spinal cord segments, and those form the brachial plexus, and from the brachial plexus comes the radial nerve. It comes from the neck and then runs behind the humerus, especially it goes very close proximity to the humerus in the shaft, and then it crosses the elbow and it comes through the extensor surface of the forearm and ultimately innervates the muscles of the hand. So that's the gross course of the radial nerve. Here you can see a detailed picture of the radial nerve. So here is your brachial plexus, and there comes the radial nerve. Right here you can see that's the radial nerve, and after it runs from the neck down the shoulder, it goes behind the humerus. Here is your humerus. It goes behind the humerus, and there is a groove called radial groove on the back side of the humerus. So it comes very close to the humerus at that point. So whenever you get a fracture of the shaft of the humerus, there is a chance of injury of the radial nerve. And after coursing behind the back of the humerus, it comes quite anterior to the humerus, especially in the lower segment, and then it runs through the extensor surface of the forearm, ending in the hand. And radial nerve is a complex nerve. It innervates muscles, so it has motor supplies, and it has also sensory innervations. So here is a list of muscles that it supplies. We don't have to remember or memorize all of the muscles, but just few important ones. Like in the arm, the main extensor of the arm, especially the major part is triceps muscle. Triceps because it has 3 heads. So we have to remember that the triceps is supplied by the radial nerve. In the elbow, important one is brachioradialis. And in the forearm, the motor supply is given by a branch known as posterior interosseous nerve. So it actually supplies the extensor muscles of the forearm. So it extends the wrist, and also it helps the extension of the fingers. Okay, so whenever you have a damage to the radial nerve, the extensor muscles action will be weak, or the extensor muscles will be paralyzed. So then your wrist will no longer be able to be extended, so you'll have a wrist drop. Okay, here is a summary of the sensory supply of the radial nerve. It supplies the posterior arm and forearm, and also it supplies below the fingertips of the medial 3 and 1/2 fingers. So I have a picture. I had a picture of that sensory supply. So if you consider that that's the back surface of the arm, so radial nerve supplies that area, also supplies the back surface of the forearm, and this finger, I mean the thumb, the index, the middle, and the lateral half of the ring finger, those areas are supplied by the radial nerve. So these three fingers and half of the ring finger, along with the lateral half of the posterior aspect of the forearm, the lateral half of the posterior aspect of the arm. So those are the areas supplied by radial nerve. So whenever you have a lesion involving the radial nerve, the sensation from those areas or in those areas will be impaired. So radial nerve injury can happen through multiple types of injury, multiple aspects or multiple facets. Like there can be a fracture of the body of humerus. As you can see from this picture or this picture, if you have a fracture of the humerus, there will be damage to the radial nerve. And there is something called a Saturday night palsy. So whenever some alcoholic people drinks too much, and then falls asleep on a couch, their hand or arm hangs from the chair, and it puts pressure. The chair puts pressure below the axilla, and the radial nerve is compressed between the bones of the shoulder, like the humerus and the chair. So the radial nerve is compressed by this for a long period of time, causing damage to the radial nerve, leading to wrist drop, because your extensors are not working properly. That's why you cannot extend the wrist, you have a wrist drop. The other modalities of injury are improperly adjusted crutches, especially in people who have some fractures or something like that in the lower limb, uses crutches to lift their weight through the axilla. Whenever those crutches are not fitted properly, they put very high pressure on the radial nerve, and it can cause radial nerve injury, ultimately resulting in the wrist drop. So those are the most important clinical anatomy points to remember for radial nerve. Thanks all for watching my video.